to add to anything at any point, please do. So today we're going over the principles of BTS. So breathing, thoracic posture, and sensing the ground. The 10-second overview.
And a Korean boy band.
And a Korean boy band, yes. Google BTS. The 10-second overview of BTS is that we need to do proper breathing, which is proper exhalation, in order to get good thoracic posture and sense the ground before we have proper posture and movement. That's BTS in 10 seconds. But breaking it down into breathing, breathing is the origin of all movement patterns and the foundation for both posture and movement. So we want to be able to breathe, be able to get into a resting position before we move and before we rotate side to side. PRI breaks it up into talking about how we have 3 different cavities. Emily's talked about it before. It's different snowballs that we have, or 3 different gears that we have. And so we have our cranial cavity, we have our thoracic cavity, and then we have our pelvic cavity, and it's stacked on all 3. With each sort of cavity, there's a central bone, and then we have bones that are alongside of it that are more like a ring shape. So we have our sphenoid with our temporal bones, we have our sternum here with our 2 sides of our rib cage around it, and then we have our sacrum with our 2 ilia around it. And essentially there is an internal posture for each cavity, and it all plays a role in air displacement and moving air for proper breathing, for proper movement, and how they all work together as a team there. The goal with breathing is to be able to move across both sides of each individual cavity, but then have all the cavities working together for the optimal breathing. Any questions on that so far? We'll go into a little bit more. So again, going back to the phases of breathing, exhalation and inhalation. We'll talk about inhalation first. What's going on at the rib cage? The ribs are doing what when we inhale? Okay, they're expanding. Our rib cage is expanding, rising. Ribs are externally rotating. Okay, so rib cage is kind of flaring. Within our transverse abdominis, our deep core muscles, and our internal obliques, when they're here, we inhale. They're eccentrically contracting. Eccentrically contracting. Our diaphragm goes from a domed shape from exhalation into flattening out like a pancake. Okay. And then when that flattens out, our lungs are able to pull down, and it increases the volume. So then exhalation is the opposite of that. So we have, first off, from the flattening diaphragm, it domes. Okay. Then our lungs, the volume in there decreases as we exhale. Our rib cage, the ribs internally rotate, and our chest deflates there. Okay. Things that we've already gone over, but it talks about properly coordinating diaphragmatic breathing. And it goes into last week of zone of apposition. Zone of apposition, do you remember last week what it was? What's the definition of that? Elisha, if you remember.
I don't remember a hard and fast definition, but I know it's the displacement from our diaphragm where it expands and contracts, right?
Yes.
What does apposition mean?
A position, changing position or abnormal position.
Apposition is like when 2 things are together,
Okay.
opposed to one another.
Okay.
So what are the 2 things that are being opposed to each other?
Yeah, so zone of apposition is the amount that the diaphragm is in contact with the rib cage. We want a big zone. We want a lot of contact with the diaphragm because the more that it can dome, the more that it's going to touch with the rib cage. If you guys remember from last week, during exhalation, we want our rib cage. What are the 3 movements that we want our rib cage to do? Down, in,
back.
and back. And that's going to create that zone of apposition. So that is how we get a good zone of apposition, is through a solid and full exhale. It's part of breathing there. Okay, so now that we attained a zone of apposition, the goal is to maintain it during movements. Okay, so before we do any sort of movement, and what we want to coach to our clients is we need to exhale first. Fully exhale, get a good zone of apposition, get a good thoracic posture there. We also have, from last week too, do you remember the 2 different groups of muscles that help maintain this zone of apposition, maintain the rib cage being pulled down?
Down obliques.
Good, we got obliques, internal obliques, and our hammies, so they're pulling our rib cage down to maintain that.
But the hamstrings they don't pull on the cage, right?
Right, well, I mean,
They get you in.
they're going to help bring the pelvic bowl underneath us and
Yeah.
bring the rib cage over. So yeah, internal obliques is going to pull the rib cage down. Our hamstrings are going to help maintain our pelvic bowl underneath us to create good stacked snowballs.
Perfect.
It also talks about in the workbook, we need to train our abs first for respiration before movement or fitness. If we are not training our internal obliques, our transverse abdominis for respiration, then we are going to just be in a constantly inflamed state with our rib cage. If we have constantly inflamed rib cage, what do we have to do to maintain control? Okay, hold our breath. That's a compensatory, fancy word, compensatory way. We have to hold our breath to help brace. Okay, we're increasing neuromuscular control, which is going to be hyperactivity, which is the opposite of breathing, relaxing, resting, and rotating. So the kind of takeaways with the breathing is that we need to fully exhale properly to attain a zone of apposition before we move. We need to train our core muscles for respiration before movement and exercise. And if we don't do that, then we're not going to have good thoracic posture, which we need. Matt, Emily, you want to add anything to breathing?
Nope, you said inflamed, did you mean inflated?
Hyperinflated, yeah, sorry. Hyperinflated. Yeah. Inflamed.
Inflated.
And fuego. Okay, so we got the breathing down. We need to fully exhale. That's going to bring our thoracic posture into place. The 3 main things for our thorax is for mobility, dynamic stability, as well as functionality. Okay, so our thorax, our rib cage, was created to move. Anybody remember how many joints we have in our rib cage?
136.
136 joints. That thing is created to move. That's why we have joints, to be able to move. We want to be able to move through flexion and extension. We want to be able to move through abduction and adduction. We want to move through internal rotation, external rotation. We really need one of those rubbery rib cage, because then you can see how mobile that is. It was created to move. What we see a lot of times when we talk about a PEC, okay, where we're hyperinflated, is their rib cage is locked. And so with proper breathing, then we're going to unlock the thorax to be able to move and have that mobility. We talk about again. What's your guys' definition of posture? What's your definition of posture, Emily?
Well,
Yeah,
be-
now it is. Now what's your definition of
Now it
posture?
would be being able to maintain whatever position you're in, like being able to breathe and move correctly in whatever position within space you're in.
Yeah, it's really good. So it's not static, it's dynamic. Elisha, you want to add anything to that?
Yeah, just being able, not just what you're in, but also to be able to transition correctly as well from one to another. It's huge.
Good, yeah. So we want to get away from posture being like a static position to it being dynamic and the ability to go side to side, front and back, internally and externally rotate. And that is the job of the thorax with its mobility. For dynamic stability, it goes back to what we were saying. We attain that zone of apposition, and then we maintain that zone of apposition for dynamic stability so that we're not compensating elsewhere. What muscles do you think help with the dynamic stability or the thoracic posture?
Obliques again.
There you go, obliques again. So we need to train obliques first for respiration to maintain that posture before we move into dynamic stability. So we need to train core for respiration before fitness. And then kind of like, yeah, we're talking about 3 cavities: cranial, thoracic, and pelvic. The thorax is in the middle, and that's going to be like where a lot of our center of mass is. And so for us to have dynamic stability, it's going to help us, having good thoracic posture is going to help us with dynamic stability to be able to transfer loads, transfer force, transfer movement without compensatory movements or breathing techniques. Any questions about mobility or dynamic stability of the thoracic posture? Okay, and then with the functionality part, there was a quote where we were just all like, amen, sister, when she read it for the functionality part for thoracic posture. A dysfunctional thorax, whether it's painful or pain-free, can be the primary driver for pain and problems elsewhere in the body. For conditions as varied as hip impingement, Achilles tendinopathy, I'm not saying that right, tendinopathy, recurrent hamstring strains, pelvic girdle pain, shoulder impingement, neck pain, core muscle dysfunction, and incontinence. So a dysfunctional thorax can create excessive sympathetic overactivity. If we don't have good thoracic posture, there's going to create hyperactivity, hyper muscle tone elsewhere in the body, which isn't allowing us to breathe, rest, and rotate. Those are the 3 things: mobility, dynamic stability, and functionality. So then we have this thing working with us or against us on Earth. What is that called? Gravity. Okay, so we have gravity. That can either be something that we can use for our good, or it can be something that's going to hinder us from movement and actually cause problems. So the line of gravity is what we talk about. It's the resistance of gravity onto our body. So it's like pulling down on us right now. That's our line of gravity. We want our line of gravity to be towards the center of our mass. Okay, we want the line of gravity to be directly in between us. Essentially, we want all of our segments, okay, our body parts, closer to this line of gravity. Best way I can think about it is if the snowballs. Okay, if we have our middle snowball out in the front, our bottom snowball, the pelvic, in the back, and our cranial out in the back here. Our line of gravity is going through here, but we have different parts of our body that are outside of this line. When it's outside of the line, what do you think we have to do to compensate?
To compensate or to correct?
To correct.
To rotate
Yeah, and if we're trying to move with all of these segments outside of the line of gravity, it's going to have to increase the neuromuscular control. It's going to have to increase muscle tone or hyperactivity within the muscles, which is not going to give us a relaxing state. You want to help me explain that one? A little
Like
bit
if
more?
we're having to function in a preset, like outside the line of gravity.
Yeah.
So we're gonna have to use our muscles more to keep from being off balanced, which creates constant tension,
Mhm.
which is not conducive toward rest, leads to anxiety and other issues.
Quote that. Boom. That was perfect. So yeah, the further the body segments move away from this line of gravity, the greater the demand for neuromuscular control and the greater the risk that the altered force line will have a negative impact on our body structures. So we talk about center of mass. Typically we want our center of mass lower, and so how the line of gravity and the center of mass, which is in our thorax area, how those relate is we have an ideal position and then we have a non-ideal position. With our ideal position, everything is going to be going towards that center. So our rib cage is going to do what?
Yeah.
Okay, it's going to go down, back, and in. With our hips, we can talk about our hips. Instead of being externally rotated, we're going to internally rotate. Instead of being abducted, we're going to be adducted. We're going to be coming in towards us. This is the line of gravity. We want everything in towards the middle. That's going to give us a nice stable environment. Okay, the opposite of that is everything moving out of that position. Okay, these segments, our body parts, the different cavities that we have are going to be outside of this line of gravity, and it's going to cause instability. More demand for neuromuscular control, more hyperactivity. Main point of that is understand that we have gravity working towards us. We can either use it as a gift or it's going to be a hindrance to us. So we use it as a gift to bring everything in and be stable and controlled, or we can try to fight against it outside of this line of gravity.
Is the line of gravity more relevant to left to right or front to back?
That's a good question. I think, this is my understanding of it, is that let's say we go into like a suitcase deadlift. So we're going to transition everything to the right, and everything is in this right lane now. And so the line of gravity is through here. Now if we were doing, so we're going to have to transition our center of mass over this line of gravity to be in a stable position. Instead of being like out here, I can already feel compensation happening. So bringing it closer, center of mass, line of gravity.
You can apply to both.
Because the same is true here. This is your line, but you're out of
Yeah.
whack this way.
Yeah, and if you're biased to the right, it's like, well, you're out of line with the center of your body to the right. If somebody has scoliosis, like the problem is the rotation side bend away from midline.
Yeah. And yeah, I remember Julie, she talked about how it's like a paper towel roll. That's going to be like making sure everything is stacked and that we're not outside of that line.
Yeah.
So that's where it goes to the...
Is that the same thing that she talked about with the lanes later on?
I think it's
Or was that something
all
different?
like integrated,
Okay.
but kind of plays a role into the line of gravity. So yeah, stable is going to be exhalation. We're going to be in a good stance. Thorax retraction, down, in, and back. Internal rotation of the ribs. The opposite of that, instability, is going to be inhalation, degrounding, flared, abducted. And then another definition of movement. Movement can be considered as shifting one's center of mass, center of gravity, around with respect to the line of gravity, what we were just talking about. We can change positions, and then what Elisha said, we can shift relationships, and then we can reference new sensory input. to alter the effects of gravity on the body.
Cool.
So that's breathing, that's thoracic posture, and then we get into sensing. So again, kind of like when we were at the conference, before we did any of the lab portions, we were all just like, okay, we were breathing. We got our thorax in a good posture. Okay, now we're going to sense the ground. We're going to sense our awareness in space.
Can you turn to the right?
We're gonna
So when
breathe.
he inhales, get in the back inhalatory position that like is supposedly good posture.
Yeah.
Alicia, can you see what happens to his thoracic spine
Yeah,
from like here to here?
yeah.
Is it flexed or extended?
Is there a difference between flexion? Oh, yeah, I'm sorry, yeah. No, it's extended.
Extended.
Yeah,
And his rib cage, like go round forward, Chuck. Rib cage opens,
right,
and then
flexes.
go rigidly straight posture. Inhale, it closes down and back.
Yeah,
So you can see why that would create a problem.
and then our normal curvature is like taken out.
Yeah, normal curvature is taken out, and it also like decreases the amount of space the diaphragm has to contact with the rib cage
Right,
in the back.
yeah.
I think that's really important because in PT school and just personal training in general, you are taught that good posture is like a flat thoracic spine. And the reason that we foam roll, supposedly, is to straighten it out because people are kyphotic or rounded forward. Because people get into this position because we type but most often, even when people get into their bad posture position, they're still really flat from here to here. They just have a couple hinge points in their spine here and here. So foam rolling this into more extension is kind of silly thinking. It doesn't make any sense. What we're really trying to do with a foam roller is just create some mobility back here so that we can get air back there, so that we can do our flexion exercises. So when people ask, my usual answer is for the thoracic posture piece, like why would we be wanting to round forward when I'm already too rounded? I'll say, well, you're not rounded in the right places.
Okay.
You're rounded here and here, and you can just have them bend forward and take a picture of them from the side and literally draw on their spine with any iPhone. Sorry, your phone probably doesn't do that. Just kidding. But they'll usually hinge from here and here, and then they're flat from here. Chuck has a nice thoracic spine because he's worked on this. You're not a good example of bad thoracic posture.
Thanks.
Sorry,
Take
Chuck.
that as a compliment.
You did it.
Good. So the breathing, the full exhale, getting good thoracic posture, and then we want to sense the ground. So we want to sense our body. We want to sense external and internal. Okay, we have receptors that are receiving information from our internal posture as well as external posture, and then even our environment, like what we're standing on, the lighting, if there was music, and how it's feeling on our feet. And essentially the positive sensory input allows our body to plan ahead for balanced movement and be prepared in advance of the movement with proper body posture. Negative sensory input, on the other hand, requires that our bodies respond to the environment around in a compensatory way and fail to get properly organized. So there's a difference when it's balanced and it's controlled than when it's reactive and having to increase our neuromuscular control. So we need to sense the position first. There's 3 different sensory receptors for that. The proprioceptors, kind of like your awareness in space. Do you know where we find a lot of our proprioceptors? What parts of our body? Okay, joints, feet, hands, muscles, tendons, ligaments, connective tissues. It's going to be our awareness of space. Then we have, I don't know if I'm saying it right, exteroceptors.
Yeah, perfect.
Exteroceptors. So that's going to be external environment. What's going on externally right now? What type of ground are we on? What type of noise that we're even hearing? the lighting that we're receiving.
What was the first one then?
Our first one was proprioceptors, our awareness of space, but that comes from like muscles, joints,
An
tendons.
awareness of internal, like an internal awareness?
I have a hard time like deciphering between the two, because then there's the interoceptors, which is more like internal organs, blood pressure, and those types of changes.
It's internal versus external environment, and then we've kind of put arbitrary labels on them.
Okay.
But then the proprioceptors say it's supposed to be like awareness in space overall.
Where our body's at.
Like position?
Yeah, position.
So how are our
Position.
eyes and ears not that?
Proprioceptors does say vestibular system.
Oh,
That's balance, which is like
yeah.
this, but then like our awareness in space, I think is more like an integration of the two. We
Yeah.
use our
Eyesight and.
eyes to figure out our eyes to figure out where everything is around us, our ears to figure out where we are in relation to ourselves, and then our brain puts them together to say, oh, this is where we are in the time and space.
Yeah, and then how do we react to those environments?
Yeah.
Good, so then those sensory receptors talk about grounding, or the sense of the ground. It gets like, I don't know, pretty in-depth.
Let's not go there. Let's just make sure everybody understands that our body's constantly receiving information from its environment. Like your feet right now, your ankles are sending information to your brain that they are plantar flexed at 43 degrees. And your brain picks that up and it knows that. Now most of that is going on completely subconscious, and the brain is like, I don't need to be aware of that right now. That's totally fine. I'm just picking up information until it becomes a problem, or until you pay attention to it consciously. Like you're not gonna consciously perceive that information. That's important. And just knowing that our body's getting information all the time from where it's positioned, what we're stepping on, where our rib cage is.
Yeah,
That's all I want people to know.
yeah. So, yeah, the more sense, or the more stable, or the more comfortable, the more safe environment that you can get into, or we can get our clients into, that's going to activate the parasympathetic nervous system. That's going to allow them to breathe, rest, and then rotate on top of that. If we have too much external stimuli, or we have too much even internal stimuli of like compensatory reaction, we're not going to be able to move the way that we need to move, or in the most efficient manner or way. So even like good grounding, if you will, is going to like lower our heart rate and lower our blood pressure, turning off that sympathetic nervous system,
Yeah.
so we can be more aware of moving instead of reacting. But then, yeah, I guess a little bit to touch on is exactly what you're saying, Matt, is feeling. Can you find and feel? So, we're talking about so many things. Can you find your left great toe? Can you find your heel as you're pushing away from the ground? Can you find your left abbeys, Can you push into my hand here? Can you find and feel your left butt muscles? That's allowing them to kind of turn their neuromuscular control, those sensory receptors on, and that allows for sense of grounding, which will make their brain know that they're in a safe environment, that this is okay, and they'll be just moving more efficiently. So, it's breathing, fully exhale, attain and maintain a zone of apposition. Our thorax is in a good posture for good mobility, dynamic stability, and functionality and efficiency with that. And sense the ground and create a safe environment, and turn on receptors to know that this is what we want to be finding and feeling, then we're going to have good, proper, safe movement.
So the BTS acronym, did they give us that as like you should do these 3 things before a workout?
That's the way that I understood it.
Do you remember, Emily?
I thought it was kind of like the foundation of explaining to people what they're going for in the exercises as well.
Okay.
So like, you're setting someone up with an exercise, make sure that they know
How they're breathing, where their
where their
thoracic spine
thoracic
position.
posture is, and are they sensing the ground. It was almost like a checklist
Okay.
that I remember.
So yeah, that would be. I mean, that's good. It's like before. Oh, that is gross. Yeah, so the way that I was taking is we do the lab, so I just would constantly. Okay, I'm fully exhaled. My thorax is in a good posture. I'm sensing the ground. Okay, and then it was like, all right, I'm going to go into a reverse lunge. Okay, I'm going to pop out here, go into reverse lunge. I'm going to fully exhale. Where's my thorax? Am I, inflated, or am I completely exhaled? And then my sense of ground. Can I feel the weight transferring through my left heel? Can I find and feel my left glute? And then was just hyper aware of that. So it is like a checklist. I think before, during, and then being able to go shift from side to side. Do you have other things to add from BTS or what you remember? Natty Babes, anything more to add BTS?
No.
Cool. And I think we're gonna next week go into more screening.